Regular physical activity has numerous health benefits. Vigorous exercise promotes longevity. However, previous studies suggest that in rare cases, it can cause sudden cardiac arrest. Fear that high-volume physical activity could be dangerous may deter people. We conducted the study to clarify how much physical activity is required to reduce the risk of cardiac arrest and whether high levels are safe. Hello, my name is Dr. Woo Hyun-jin. I'm an assistant professor in Division of Cardiology at Inje University Sangye-baek Hospital in Seoul, South Korea. The title of our study is Association of Physical Activity with Primary Cardiac Arrest Risk in the General Population, a nationwide co-study of the dose-response relationship. And it will be published in the April of 2022 issue of the Mayo Clinic Proceedings. Briefly, data were obtained from the Korean National Health Screening Program. The study included over 500,000 adults. Physical activity information was collected by questionnaire and categorized relative to the public guidelines recommended minimum level. We evaluate the association between the amount of exercise per week and the primary cardiac arrest occurring in the community. We found that the beneficial effect of physical activity on primary cardiac arrest started at 2/3 of guideline recommended minimum level and continued to 5 times. In addition, there was no increased primary cardiac arrest risk at level above the 5 times the recommended minimum. These associations were consistent regardless of age, sex, and cardiovascular disease or lifestyle factor presence. From a public health perspective, these findings are informative for people at both ends of the physical activity spectrum. For inactive individuals, they show that even small amounts of activity are good for health, while reassuring very active individuals that high-volume exercise is not associated with an increased risk of sudden cardiac arrest. More extremely, those of physical activity association of this topic, randomized control study is needed. We invite you to read the details of this study that will be published in the April 2022 issue of the Mayo Clinic Proceedings. Thank you for listening.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.